building networks of structuring institutions in national health systems in the community of Portuguese-speaking countries, fostering human resources for the public health sector. In Estoril, near the Portuguese capital Lisbon, one of the flagship projects of the community of Portuguese-speaking countries was born: the Strategic Development Plan for Health Cooperation, known as PECS in Portuguese. Based upon a strong strategy, the CPLP focuses on health as an essential factor for development, consolidating the obvious connection between the adequate preparation of professionals in this field and the quality of care provided. This innovative strategy quickly captured the interest of various stakeholders on the international stage. For this purpose, it went a long way to introduce practical and logical north-south-south or triangular cooperation, having been recognized as an example of good practices by institutions such as the World Bank and the European Commission. The PECS is based on 7 strategic areas, from which priority projects were defined. They all share a common orientation. They are conducted under the banner of fostering human resources for the public health system. Technical cooperation in health within the CPLP creates a structuring framework in contrast with the traditional approach of vertical programs and projects. The PECS CPLP, in order to discourage defragmentation, defines networks of structuring institutions in national health systems whose components are the best proceedings in which cooperative actions may be implemented. The principal ones among them are considered to be networks of national public health institutes, RINSP, CPLP, national public health schools, RENSP, CPLP, technical health schools, RETS, CPLP, and technical centers for maintenance of facilities and equipment, CTIM, CPLP. The network of technical health schools in the CPLP, established in December 2009 in Rio de Janeiro, underlines the structuring nature that schools play in training health professionals for the public health system. The network of public health institutes, established in 2011 in Bissau, is another key example of the PECS, aiming to promote the strengthening of strategic solutions and responses of public health systems in member states. By consensus, it was decided to promote the advocacy and support for the creation of national health institutes in member states in the network, which still do not have this structure. This is the case of Cape Verde and São Tomé and Príncipe, where efforts to finalize the constitution of the national health institutes are being concluded, and in East Timor, where RINSP CPLP will support a new framework for the respective institutes.
Sem o apoio da CPLP isto seria muito mais difícil, porque tivemos de facto no quadro deste projeto RINS, portanto da rede dos institutos, não só a assistência técnica, mas também o benchmarking. Pudemos deslocar-nos à comissão instaladora, portanto que foi feita após um estudo organizado no quadro deste projeto CPLP. Tivemos assistência na definição do platô que deve servir o Instituto. Tivemos que, há normalmente um conjunto de 11, 13 funções que os institutos podem desempenhar. Nós tivemos que, de facto, adaptar a nossa realidade. Ajudando-nos essa assistência técnica nessa direção e já temos agora, portanto, o diploma que cria e que já está no circuito legislativo. Até ao fim do ano teremos o nosso Instituto, que, portanto, é de facto primeiro, muito importante. Segundo, sem CPLP não estaríamos tão avançados e espero que possamos continuar a ter esse apoio para garantirmos que, efetivamente, esse Instituto seja criado e tenha a assistência técnica necessária para nascer bem.
A presença de um Instituto de Saúde Pública com vocação, por um lado, para a investigação, para a pesquisa, e, por outro lado, com vocação para a formação, vai necessariamente contribuir para o grande salto que nós queremos dar na melhoria das condições de saúde. E nós estamos profundamente convencidos que a nossa motivação vai nos levar a isso e estamos crédulos de que conseguiremos todo o apoio necessário por via desta comunidade, que é a CPLP, e naturalmente de muitas outras comunidades científicas interessadas, portanto, em colaborar, portanto, em situações, nos países onde existam, de facto, os pré-requisitos para efeitos de investigação.
Além de fortalecimento, nós também somos membros do país de CPLP. Espera no futuro poder nos suportar para estabelecer instituto de tal maneira baseando como padrão de CPLP em geral. Vamos tentar para criar uma boa política em termos de alto nível para poder se estabelecer instituto nacional de saúde pública como tal dos países de membros CPLP.
As for the network of technical health schools, RETS CPLP, the intention is to work in a coordinated manner in order to exchange best practices in strengthening the capacity of middle-level professionals with methodological and operational tools that will improve their performance in respect to the populations they serve. The strategic plan for health cooperation in CPLP also contemplates strengthening structuring networks with the institutionalization of the National Network of Public Health Schools, RENSP CPLP. After a period of some dialogue among CPLP public health schools, preparation and formalization of RENSP CPLP as part of the PECS CPLP was held in September 2013, having proceeded to conduct an evaluation mission in Angola and Mozambique to make a diagnosis of the situation of public health schools in those countries. Following the RENSP CPLP evaluation missions to São Tomé and Príncipe, Cape Verde and Guinea-Bissau to expand the vision of the situation of public health training in the CPLP and to facilitate the preparation of a joint action plan, the formalization of the RENSP network of health schools will take place within the CPLP with concise, objective proposals and shared activities in the first months of 2014. As a complement to these networks of structuring institutions of national public health systems, thematic research networks have also sprung up, providing a technical and scientific support to the ministries of health and the CPLP networks, and pooling available expertise from member states. Special mention needs to go to the Network for Research and Development in Health in the CPLP for malaria, the RIDISMAL network, and the Network for Research and Development in Health in CPLP for STT, HIV and AIDS, RIDIS-IST-SIDA network. The Strategic Development Plan for Health Cooperation in the CPLP is a reality that is contributing to the strengthening of public health systems and to the guarantee of universal access to quality health care. To this end, decisive cooperation has been delivered by partners like Fiocruz from Brazil and IHMT from Portugal. All this process has only been possible with the instrumental support granted to CPLP by the World Bank in the form of a grant agreement. Thank you, World Bank.